Join us tonight on the front lines of New York Med, where the fight to save lives is fought case by case.
There was a home invasion.
They followed me upstairs.
One came over and put the gun to my head.
I thought he was going to do something terrible to her.
He saved me.
So this man was apparently struck by the subway.
I feel so lucky that I'm able to be there for people.
My heart is 5 times the size of a normal heart.
If he doesn't have a heart transplant, he will die.
They're going to cut my baby open and take out his heart.
It all happens here in New York City, home to some of America's best hospitals.
Make sure we still got a pulse.
You're not going to die. Sit back, sir.
South Orange is your cross, number 1 flooding, 1403 and 2401.
Your doctors are like the Marines. I mean, we hold the front lines. We are the badasses of doctors.
He's right about that.
Damn right. We're the doers of medicine. As an ER physician, that you're able to have this opportunity to see so many terrible things. Is this a gunshot wound?
Yeah.
All right. Can't save everybody. Can't save the city. But whenever someone gets hurt, I have to just take care of that patient at that moment, because I owe them that.
Put out a level 2 trauma page. Coming in with an unknown age young male. Assault, victim of a home invasion, possible facial fractures, awakened conscious.
We have a young gentleman. There was a home invasion.
They followed me upstairs and they forced me to let them in the apartment.
I think he protected his wife.
My fiance. We're not married yet. They pushed me down on the couch.
Okay.
And they were pointing the gun at me. And I thought he was going to do something terrible to her. And then she started screaming and he turned to look at her. Then I grabbed the gun with both hands. His buddy jumped in. That guy was hitting me too.
All right.
The back of the head, the front of my head.
Did you get knocked out?
Yeah, when I hit the floor, I think I lost consciousness.
You're a hero. You're an American hero.
All I could think of is I didn't want them to do anything to her, you know?
I know, man. All right, we're going to take care of you now. Deep breath. The problem is Hurry's kind of fast. So as we're worrying with the trauma, make sure there's no bleeding or internal injuries.
Hey, bud. My name's Adam Fox. I'm one of the trauma surgeons here. So tell me exactly what happened to you.
Okay, so I went out to take the dog for a pee. The guy comes up and he says, "Can you let me in?" I just told him, "Look, man, my dog is not going to pee with you standing here." And it's the truth.
So we're going to scan through his head because he passed out.
Beyonce apparently is information on the other side. They're going to do a rape kit and all that crap.
Oh, really? She said that the girlfriend may have been sexually assaulted while he was passed out, which is horrible. And that won't be communicated to him, at least certainly right now.
I'm just so scared. I had to watch them beating him and I couldn't do anything.
All right, my dear. What's up? I'm Dr. Rosa. Our
Okay.
supervisor.
The doctor is here. I have to go. I love you.
So I hear your fiancé is a superhero. He saved the day.
The one came over and put the gun to my head and said to give them the money or they would kill me.
Jesus.
And I pushed the gun away. I grabbed the barrel and pushed it away and he yelled at me, "Are you stupid?" He pushed me down on the bed and he pulled my pants down right here. And
It's all right.
he started touching me and then I was screaming and fighting him and my shoulder hurts really badly, I think, from fighting him.
Let's have you, can you lay back for me? Let me close this curtain real quick. So the update with him, so far he's looking pretty good. So I don't want you freaking out, okay? So far he's looking good. His heart rate's a little fast, but he's still with it. He's smiling and he's super proud that he saved the day.
His heart rate is fast.
Okay.
He saved me.
He did save you, okay?
The guy was starting to rape me.
He saved you,
and
saved the dog.
Me. I'm pretty sure the dog saved herself.
Well, the dog
she went in her
saved herself.
cage. She's very smart.
So the dog
my
saved
little
herself.
baby.
They went through quite an ordeal. Hopefully we'll try to get them together so they can see each other, see everybody's fine. So she doesn't keep freaking out. 2 people could have been killed today. So it was a close call.
19-year-old male, gunshot wound to the chest and shoulder, ETA 2 minutes.
There's a gunshot wound coming in.
Set up a chest tube, please. Get it all ready.
This is a night shift for you.
19 male, shoulder, exit, and entrance.
How many times were you shot? Okay, I'm gonna feel it in 1. Okay, it's all right.
I'm not a baby. I'm not a baby.
You're done. It's okay.
Raise his arm up, just looking over here for gunshot wound. So you're sure you got shot once? You didn't fall at all.
No.
You just kept on running. Can you squeeze my hand for me, honey? Good. And do this. Put your thumb up, like thumbs up. Good. Are you able to bring your arm out like this and bring it in towards your body? Good. He's pretty intact. Do you know who shot you?
No.
Okay.
I just saw him, so we was about to.
It's got to be on abdomen.
You don't know who he is?
I know who he is.
It looks like it. He said
Sounds a little shady. And I said, do you know him? He's like, no. And then he was like, yeah, I do know him. It was probably just shady business. Who knows? That's what the cops are here for.
There's a little air there, right? But that's about it. That's pretty lucky.
I just came back from school. I took a week off because I just had a son. I was gonna start working.
You just had a son?
Yes. 5 days ago.
Congratulations. You have a lot to live for. Ooh, baby. How old is the baby?
5 days old.
Oh my God.
Despite getting shot in the shoulder, his actual shoulder joint is okay. At this point, it's just like a cut where we don't even sew it up. We really just put it in gauze, and then really it'll heal on its own.
I was just thinking about my little son, Blake. That's all I was thinking about. He was born 5 days ago, so.
He's a combination of really unlucky and lucky. Really unlucky that this happened to him tonight, and really lucky that it wasn't anything serious.
I'm gonna check in on that couple that was assaulted during that crazy home invasion. See how they're doing. How you doing, my friend?
I've been better.
All right, so crazy, but you saved the day, you saved the dog, you saved the girl. A couple broken bones, as you know, in the face. We're gonna have the specialist take a look. Brain's good, neck's good, everything else checks out. I'm impressed, dude. Good job.
Thanks.
Inspiration. The problem is I don't know if he knows about the assault. To be honest with you, he has a couple fractures, but his brain's good.
He has fractures?
They got the best ears in town. Checked all his organs. Looking good.
I just want him to be okay, please.
He's okay. He's okay. He's okay. I promise you, he's doing fine. Okay? That's what I'm having the specialist see him now, and we'll go from there. And if you're both are okay, then we can have you guys say hello and all that, okay? So the CAT scans actually look good. So it looks like no injury to her neck, nothing to her skull, brain looks fine. You open for visitors? Alrighty. What's up, everybody?
You were so brave.
Gotta do what you gotta do, right?
Honey, you were willing to risk your life for me.
What did you think I was gonna do?
Protecting your woman, I respect that. Save your dog, save your girl, save the world.
Human beings are vulnerable. As doctors, it's our instinct to help them. You let me know if anywhere I press hurts, okay? I'm a heart doctor for kids. I take care of these incredibly brave kids who are going through things I can't even imagine. Chris Molnar is a 19-year-old with a cardiomyopathy, which is a disease that enlarges the heart and weakens the muscle.
I actually just graduated from boot camp for the Marine Corps, and I was home on leave, and I had a stroke. My friends were all real shocked. They all saw me like the day before, and then they get a call or whatever. I'm in the hospital with a stroke and I'm in heart failure. When we first saw him, we knew right away that he was very, very sick. Okay, take a nice big breath. They said my heart failure started at boot camp, most likely. They keep asking me, they're like, didn't you feel bad, didn't this, but it's boot camp for the Marine Corps. Everyone feels bad. Any pain at all in your belly? It hurts, like, not like a little bit under the scar. Right. It's mostly just when I like press on it. When they were searching for what caused the stroke, they saw I was in heart failure. They said I needed immediate surgery to get the pump put in to keep me alive.
Chris has an LVAD, which stands for a left ventricular assist device, which is a heart pump that is surgically placed that takes over the work of his failing heart.
We didn't think right away that he was that sick. This was him the day after surgery. I didn't sleep. I stood next to the bed. They brought me a chair and I kind of sat in it once in a while.
It was hard. It was real hard. We were prepared to say goodbye to him.
Well, we were in the process of saying goodbye. They had pulled us aside and with a chaplain. It was devastating. Because as a mother, your job is to take care of and protect your child. And I couldn't stop it from happening.
Okay, any issues with the device that you're aware of?
Not that I'm aware of. Okay. He has like spots on his legs.
Yeah. Chris can't survive on the Elevate pump indefinitely. If he doesn't have a heart transplant, he will die.
It's my dessert.
In the beginning, it was really depressing. You're just sitting there thinking, he's 19 years old. This is my younger brother. Why is this happening to him? This isn't fair.
He watches out for his sisters.
He's very protective over me. That's a big thing. I can't date till I'm 30, and I can't get married till I'm, 50?
Yeah, something like that.
No first kisses soon, right?
It's a good plan. It's tough on them. I know it's tough on them. My heart is 5 times the size of a normal heart. I can never live without a transplant.
When it first happened, when he first had the stroke, I didn't know what Christopher could hear and understand, and I didn't want him hearing his father be upset and think, oh my God, I'm dying. And then there comes the father in and starts sobbing. And I'm like, seriously? Get out! Send me somebody who can keep it together. And you can come back when you've composed yourself.
You little wimp. Get out. Right now, it's really just a waiting game. Everyone's real, nervous about it. Everyone's, scared a little bit. And so every night I, think, oh, maybe I'll get a heart tonight.
It's an unnatural way to live. We're waiting for a phone call. I mean, bottom line is somebody else has to die so that he can live. And it feels a little selfish. We're treading water right now.
All we need is a spark, a second chance, a lifeline.
Male struck by train, ETA 1 minute.
Dr. Blazieski to A1, please.
What is it?
I'll go A1. Gentlemen, struck by train.
I knew this night was going to be like this. I knew it. It was too quiet.
Leanne, set the airway. Gabby, what is it?
Train versus human being.
Oh.
A1, notification is A1.
Hi.
What's up, guys? His initial blood pressure was 201/180. His O2 sat was 100%. Right pupil is pinpoint. No obvious fracture.
Bilateral breath sound?
Bilateral breath sound there, of course. GCS of 3, he's not reactive.
Okay. Don't push the meds yet. You guys, this place is about to become a storm because we just activated trauma. Let's make sure we get this line. Let's get some labs.
We're going to need somebody to hold these lines. We don't know if someone pushed him, if he slipped, or if he jumped. But it doesn't even matter. We have to do our job.
G, do you feel something to get a line in? Yeah. Let's tape it, guys. So this man, we don't know anything about him, but he was hit by a subway train for his own safety, and because of his exam, we intubated him. Jason, what's the D? You need to have purposeful movements. Okay. We can get some x-rays for him. My career before emergency medicine was in investment banking. Is this IV working? Yes. I lived downtown. I lived with my sister. It was March of 2003, and my sister was run over by the subway. Can we grab another 50 of rock? My sister ended up having her leg amputated. She was very, very lucky to be alive. I spent every day with my sister in the ICU, and it was at that point I realized that I had to become a doctor. A good feel of his arm so we could see what else we need to x-ray? Maybe it's because I feel so guilty because I wasn't there for the first 27 hours for my sister. They already set up. They set up in CAT scan already. But I feel so lucky that I'm able to be there for people in their moment of need. When someone is struck by that amount of weight, and no matter how much you move, you're really, trauma, yeah. He's lucky. He's lucky. He's very lucky he's alive.
How are your batteries? Did you put the others on the charger? So how much does it have, the charge?
50%.
So I just got word that there's a heart that's a match for Chris Molnar. The transplant team should be calling him now.
Hello?
Hey, Karen. So this is the call you've been waiting for. We have a heart for Chris.
Awesome.
I have high hopes for this one. I really do.
Sweet. Does it have any anomalies? Are you able to tell me that?
Everything looks great on paper, but we'll send our team to actually look at it there.
Okay.
So what I need you to do is take a deep breath and get yourselves ready and to head to the hospital.
All right, thank you. Okay, bye.
Bye-bye.
What do you think?
Not too shabby.
You ready?
I'm excited. Yeah, that was a good phone call.
This is good. This is really good. Yeah, this is exciting.
Am I the only one that's nauseous? Seriously?
Yes.
You're all fine?
Yeah. Seriously.
We really hope that Chris gets this new heart, but it's still early. The procurement team has to visualize the heart and let us know if it's a good heart.
Now I'm anxious. And waiting to get through this next day is going to be hard. I worry about what's to come, what could happen.
Hi, I'm Marina. I'm going to be a nurse.
Oh, good.
You allow him to flirt with girls like that? What brings you to the ER?
Chest pain, vomiting. I was holding to the desk because I was just coughing so much and it hurts.
Let me just listen to your lungs. We're going to just do a chest x-ray and draw out your opponent to make sure it's not anything with his heart. Just because he looks good doesn't mean he is good.
I really didn't want to come to the hospital, but
he's stubborn like most men. So, but his health is more important than his cool points. So once I told him that, he was ready to go for the ride.
Then I'm gonna draw some blood, okay? Do you have to do that? It's gonna be a tiny pinch. I'm very good at it, okay? Can't blame them. I'm scared of needles myself. And I'm sticking people for 9 years. Listen, stop being a scaredy cat. Always the big guys are afraid of needles. Where do you prefer it? I'm giving you a choice.
Yeah, don't do it there.
You're making me nervous now, buddy. Oh, God.
You can't let me see the needle.
Don't look. Take a deep breath. The faster we do this, the better off. No, you can't move. I have never met a bigger baby than this.
Stick her and hurt yourself. Relax, exhale, and go to your happy place. Breathe out, buddy. You're doing good.
All we need is a couple of drops.
Your blood is as scared as you are.
I can't believe it.
I can't believe it either.
I'll be a witness to this. Your cool points are gone.
Got my bag? All right. Right now, I'm worrying, is it really going to happen? And is it going to go well? I'm trying so desperately to be strong for Christopher.
I'm very grateful, but at the same time, it's just constant up and downs with everything. You never know what's going to happen.
Congratulations. I said congratulations, but we still have to wait for the procurement team to let us know the heart looks good. Otherwise, it's essentially a dry run. We're going to come back and talk to you after we get the phone call when they actually look at the heart. There's no abnormalities whatsoever? All right, sounds great. Jonathan said the heart was good, so yeah, he said they visualized it, called him, so I'll just tell the family. All right, good news. The heart looks great. Awesome, so where to go?
His new heart is on its way home.
A little bit closer.
You're welcome. At this point, we're going to go ahead with the transplant. Our team has already acquired the heart, and they're actually on a plane back to our hospital. Dr. Chen will do the hard part of putting the heart in.
Hey there. Well, you ready?
I am.
Okay, good.
I'm excited.
Okay, I'm ready and I'm excited for you too.
Yeah.
I'm pretty quick. Biggest risk with this operation is bleeding, and then there's a lot of scar tissue that he has from his prior operation. Heart surgery, of course, is never a free lunch procedure, so there's always a risk of infection and bleeding and death and strokes.
I'm ready to.
Gonna be okay.
I know. I'll be fine. See you, Pops.
Bye, Christopher. They're gonna cut my baby open and take out his heart.
It's gonna be fine. It's gonna be fine, sweetie. It's gonna be fine.
So I was always told I'm not going to amount to anything. Just point to my town where I came from, like pretty much every other Latin teenager. No one really expected much. Most people expected for me was to go to work at McDonald's, something of that nature. It's almost like I wanted to show all those people that they were wrong.
Yeah.
Sorry. What do we got? What's the story?
Possible septic emboli.
Okay. His heart stopped. He went to cardiac arrest. AC electrodes, give me a round of epi, give me a pulse check, and get him on monitor. Who knows the medical history?
We actually came down to get an MRI to rule out osteomyelitis.
Even though everything's going crazy, you just zoom in that moment. I like when it's all that pressure and you have to try to pull it off. That's when I'm at my best. Time out, check a pulse.
I don't feel pulse.
Continue compressions. 1 minute. Give me a BP cuff. Let's run a pressure and see where we're at. We're getting a pressure right now.
Oh, we got a pulse. There's a pulse here.
Chris? Yeah, here's a pulse. So in these situations, it's a lot of anarchy, but the key is to be a team leader, be able to calm everything down and run the code. Pulse is still good?
Good.
Okay.
Good.
That is a rush. Gave him 3 rounds of epinephrine. His heart came back to life. It's a good feeling. You don't get that often. So the key is to be the fastest person to get there first. You can't save a life if you're not there. Oh, man.
Some nice deep breaths in and out through your mouth. Did a great job, Chris.
Taking out Chris's heart shouldn't be a particularly difficult operation. The difficulty is going to be taking out his device, which has been overgrown with scar tissue.
Let's see. This is Christopher when he graduated with his friends. And then all of us. He was so horribly skinny. Had no clue that he was a death's door.
Okay, so let's see what we got in here.
I have to say, this guy's story is amazing.
He's a super tough guy. Am I right? Have we still not heard from the donor team? Right? They haven't called, right? Okay. Oh, wow. Yeah. His heart and his LVAD are scarred to the underside of the sternum, and he's bleeding quite a bit. It's really stuck here. All right, well, try from the other side. Yes, ma'am.
Heart will be in the room about 15 minutes.
Okay, got it. Thank you. Or we've been taking too long. Let's try to get the rest of this crap out. This case is beginning to irritate me.
Every time you come to work, you're never sure what's going to happen. Sir, where are you going? That's why I like this job. It's like you're a detective, you're an action star, you're everything.
You're a doctor?
Yeah, I took care of you yesterday, remember? I've never had like an easy patient. It's like elbow pain, but I also have vaginal bleeding, and you can't win. Were you drinking today? Jesus, where all the feathers come from? Every time I open a curtain, there's like a whole new surprise. Hello, everybody. Welcome to the trauma center.
Got him here sooner.
She's in charge?
I'm his sister.
Okay, so what happened? What brings you here? You seem like a healthy guy.
Yeah, well,
what happened?
My legs, my feet are
Burning. It's dripping with water. It's coming out.
Okay, let's take a look.
I mean, it's...
Okay, is this worse than normal? Is this what it always looks like?
This is always
This is what it looks like.
Okay, how long has this been going on?
Over a year.
So if I met you a year ago, completely normal legs?
Yeah.
But you haven't seen a foot doctor or anything?
No.
He thinks they're going to cut his feet off.
Now, normally this is always a sign of something else going on. Either problem with the blood vessels or heart. You been short of breath at all when you're walking around?
Yes.
Can you actually walk?
No.
Yes, I can
He
walk.
walks
When they're not hurting.
to the bathroom.
So why today? What happened today that was different? Why, after all this time, why'd you finally come today?
It was burning me so bad. No matter which way I put my foot, I couldn't quell the nerve.
Wow, you waited a long time, my friend. But you're here now, okay?
Arguing with him, the stubborn man, I couldn't.
Yeah,
So how'd you win? How'd you win today?
I told him I can't live like this no more.
Okay, we're here now, so we're gonna take care of everything. Do a lot of blood work. We'll do some x-rays, make sure nothing else ridiculous is going on, make sure his heart's fine. And
he's the other thing, he's got no insurance. That's the other thing he
That part
fights with.
doesn't matter.
I ain't worried about that.
I would rather live.
you've done all the work, okay? I can take over now. We're gonna try to figure out what's going on, help you from a health standpoint, get you the social worker, charity care. We do all that. That's what I do all day long.
It's my brother. I can't walk away.
Are you gonna let us take care of you?
Yeah, I'll do what I gotta do.
Okay, don't go anywhere, okay?
He can't go nowhere. He can't walk.
It's kind of intense, actually. You don't see that every day. I'm used to the gunshots, the stabbings, and everything else. Hey, everybody, I brought my vascular surgeon.
What's going on with your legs?
My legs just feel like they weigh a billion pounds.
You have never seen a doctor before?
Yeah, I've seen it when I had my appendix. Wow, that was young when I did that.
A lot of stuff we see here is just patients who don't actually see the doctor. Like if someone didn't go to the doctor after a year, this is actually what could happen.
So you're gonna have to try to see if you can cut this here. Slowly losing my mind.
The heart is here.
Now I'm gonna take you out bypass briefly, okay, ready? Scissors. Okay, in between please. Okay, here's Chris's heart.
We're approaching about 6.5 hours that the heart's been cold, which is sort of on the outer limits of what I feel comfortable with.
Yeah. I think I'm so nervous I can't really be excited right now.
There's always that possibility that something could go wrong.
Here comes the hard part. Oh my God. Oh, Christ. This LVAD is very encased in scar tissue. It's just going to take a couple shears to get through there.
I'm still holding out. Not fast enough for me. And I want him where I can see him.
There we go. So this is the heart. So you can see how big this is. This is very diseased and large, right? Should not be that large. You can see the size of my hand, right? Okay. Jeez Louise.
Definitely a very big, ugly heart. So I needed to come out.
This is Chris's new heart. It's a good size match for him. Good. Pull up. That's great, thank you.
So the old heart is out. The new heart, Dr. Chen is sewing in right now. The next big hurdle will be coming off of the bypass machine and letting the new heart take over.
Okay. Thank you.
We need paddles, please, to 50 right now.
Charging.
Thank you. Hearts that have been in the cooler for a long time will default to irregular rhythms. You try 75. The only way to get the heart out of that rhythm is to shock it. Come on. Charge again, please. Come on. One more time. Come on. You can do it. There's something wrong.
There's my buddy, Mr. Kaiser.
Hello.
Whose voice do you think this is?
I don't know.
Darling. It's all about that first impression, that feeling you get when you see a patient.
Where's Dr. Oz?
Dr. Oz? Should I go find him? You won't settle for me?
I take what you can get.
Oh. We like challenging patients. I'm going to see a lady who came in with a sore throat and a fever. Ms. Caban? Hi, I'm Dr. E. Nice to meet you.
I came home from work and shut down.
You know the dog whisperer from television? I can tell when anyone has a fever. So you have a fever.
I have a fever.
And I think it's 102. By checking, feeling your back, I think it's 102. Okay? Do you smoke cigarettes? You do. How much do you smoke?
I have a pack a day. That's better than a pack a day I was smoking.
Okay. Open your mouth up and say, With the combination of the fever, the swelling in the neck, it makes me think that there's a good chance that this is a bacterial throat infection, okay? So smoking is definitely contributing to the reason why you're here today, okay? Can you make a pinky promise with me that in 6 months you'll be not smoking anymore? Okay. No smoking by 6 months, okay? Nice meeting you, sweetie.
Nice meeting you.
Please note, my patient just went outside. I literally talked to her 2 minutes ago. Let's see what she's doing. Where are you going?
No, I was looking for a signal for my phone. I wasn't
making sure.
I wasn't smoking a cigarette. That's all.
I was like, I just talked to her 2 minutes ago.
I wasn't smoking a cigarette. I didn't want one. I just wanted a signal. That was funny, though. Imagine if I did, huh? Oh, Jesus.
Yeah, I'm the anti-smoking campaign and the fever whisperer. Those are the only 2 skills I have, and eating heavily. Those are the 3 skills I have.
Marshal left, 6-5, Marshal left.
Come on. Charge again, please. Come on. Charge again, please. One more time. Do it. Never say never.
Last we heard was that the old heart was out, the new heart's being sewn in. They warned us that sometimes the hearts, after they've not been beating for a while, aren't so enthusiastic about starting up right away.
Try it again. There we go. Yep. Fantastic. What a goddamn miracle. Chris's heart is back to regular rhythm. It's actually beating on its own now. These are the first beats of what you're catching on the screen there. Function looks good. The pressures are normal. Particularly good for a heart that's been out of the body for as long as it has. That's great.
The heart's in, and it's pumping perfectly. So congratulations.
It's good news. It's damn good news.
That was difficult. He's an unusually robust kid, so all of his tissues, the scar tissue and things were particularly strong, which made things a little bit more difficult. Hey, how are you?
You're here that he's done?
Yeah, I wouldn't say it was a chip shot operation, but it went fine. He's fine. The new heart looks good, and it's working well. His blood pressure is on the low-ish side, so he might be on a fair amount of medication in the beginning, but hopefully we'll be able to wean that off over the next day or so.
And the heart was ugly. So Dr. Steve
His old
said.
heart was really ugly.
Yeah. He
for
said it was
Chris.
ugly and it was time to come out.
No question about it.
The surgery was pretty extensive. The next 24 to 48 hours, I think, are the most critical. You're going to see how this new heart adjusts to its new environment. But, all in all, I think he's going to do very well.
They saved our Christopher. Right? I'm about to see Rishi, my fiance. He's also an emergency resident. We don't get to see each other very much because we work opposite schedules. Dude, did I tell you about this patient I had the other day? She was coming in. She came from Papua New Guinea.
Papua New Guinea?
Yeah. Remember we were going to go there?
It's like her and Rishi are like the prom queen and king. It's like they're all popular with their like nice little perfect relationship and always all happy and in love.
So basically when I'm working days, he's working nights, I leave and he comes in.
It's fine. She makes dinner and leaves it in the stove for me. Sometimes. Maybe tonight.
The marrying of two doctors, that's every Asian family's dream. Love you, babe.
I love you too.
Sometimes I feel like I'm like a waiter. I'm going like table to table. Welcome to the trauma side. What the Oh, there's ladies here. Did you drink a little?
Yeah, I drink.
You drank a little bit?
I drink a lot.
A lot of it. Any pain anywhere? No pain anywhere? You didn't get beat up?
No, but you know what?
Tell me.
You is a funny.
Thank you.
You're a good guy, right?
I am the good guys. We're gonna check your blood pressure real quick.
Tell you something. I'm not the one to be.
What's his name?
James.
Whoa, relax.
Hold up.
Relax. Whoa,
now,
whoa.
you want to know what my name is?
Relax.
It's James.
James. Danger.
James. James.
What? Whoa.
Oh, is that in the bridge of your nose?
Oh.
You.
Dude.
Man, don't be hitting people.
Guess where your phone goes now?
You.
I have dodged so many bullets.
This is why I'm not going to let him live it down, because
I've gotten in like the craziest fights here.
Hugo has taken down people wielding knives, but then this 79-year-old guy with the cell phone. Ow! Do you want to donate to the Hugo Relief Fund?
Is there really money in there?
Yes.
There's change.
I got you 60 cents so far for your injury. Razo Relief Fund.
Some blood for me.
The old guy snuck me. It's the biggest cut to my ego.
Some of these These old New York ladies, they're just so entertaining. This is why I love my job. What are you here for?
Hard. Stress. Never live alone in New York. Never rent in a condominium that has a stinking board. Right. I needed an apartment. It was in a good neighborhood. It had a doorman, concierge, anything with a French name. Sounds better.
Sounds better. Sounds richer.
To the New Yorker.
Mm-hmm. So you are kind of a big deal.
You better? No.
Do you have the lady in the leopard hat?
Yeah, she's hilarious.
She wanted me to tell you that she doesn't want to die because of your incompetence.
They said I wasn't allowed to eat food because of my heart. Is that kosher meat? They want me to drop dead from it.
See, now you're complaining when you have food. You were complaining all day you didn't have food.
Who's in charge of this?
Yeah, she's like terrifying. Like she's scaring me right now, and nobody usually scares me.
I have a pain here. I don't want a stroke. I want my blood pressure taken immediately.
I'm gonna do that right now, boss. We worked her up. So far, everything came out negative, but we're gonna have her on continuous telemetry monitoring to make sure she doesn't have anything going on with her heart.
In this world, if you're not laughing, you're crying.
Exactly, and that's why I want you to keep laughing. I don't want you to be stressed out, okay? It's like she's so funny, and then she'll like laugh at my jokes and her jokes, and all of a sudden she's like, what are you laughing at? We gotta take this serious.
You said another EKG would be taken, so when health freeze is over?
It looks like all the tests are still negative for any cardiac issues, so I think we're just gonna discharge her. Is this your friend?
That's my best friend.
Really? Hi.
I am so happy. I can't tell you. I haven't seen her in 22 years. I lived in Bayside. She lived in Manhattan.
I couldn't come yesterday.
My heart is better. It's going boom, 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 boom.
See how fast attitudes can change in the ER? It's crazy.
Volare, oh, oh, cantare, oh, 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 nel blu dipinto di blu.
Can't be that sick, Gloria. You're not that sick.
If you didn't know what's under that shirt, you'd never know all the scars and everything after the transplant. Christopher looks great. And he's back to his obnoxious self with his sisters. And we wouldn't have it any other way.
Compared to before the surgery, definitely I feel a million times better.
Right.
Now I just feel like good again.
He's done amazing well handling it, dealing with it.
Your whole life has changed forever. I told him there's got to be anger, there's got to be grief. This is a loss. You got to deal with it, you know?
That's it. I just got out of boot camp and then it all ended right away. Now, since the transplant, I have to get discharged from the Marine Corps. Since the 4th grade, my whole life's been the Marine Corps. So I'm not really, at this point, I'm not really too sure what I'm going to do. What's this? But I'm very grateful right now that I got the transplant and that I'm still alive and everything.
As long as we're together and everyone's feeling good, health is where it is.
Mm-hmm. The rough part was over.
I had promised him puppies. Right after the surgery, I said, whatever you want, I'll get you a puppy, just don't die, you know, stay with mommy. And he didn't, so I had to make good on my promise.
They were born about 2 weeks before I got my transplant. So we always say they're 2 weeks older than I am.
He's back. He's back.
Oh, it's fine.
Love you, Mom.
Love you too, Pooh Bear.
Today is my Korean wedding ceremony, which is called a pebek, and after that we're having our wedding reception. I didn't get any sleep last night. It's a big day, I guess. It's kind of sinking in now. I'm actually kind of nervous. We're both from cultures that very much appreciate family. I'm Korean and my husband is Indian. So being able to bring these two cultures together, you know, for one Korean family, I mean, it's excellent. extraordinarily lucky, you know, that he makes me happy.
On New York Med.
We have a 19-year-old plane crash survivor.
You feel the vertical line drop. It's horrifying.
This is cancer here. I give everything I have to my patients. I feel like I can't really give to anyone else.
There's a hole here between the right and left side of his heart.
My biggest fear is not waking up at all.